So basically what's happening is that the reason we leave, as we discussed before, the reason we leave the tube in after the surgery is because there can be leakage of things, usually air from the lung where we cut it, or sometimes some fluid from the raw surfaces where we did the surgery. But I don't know if you noticed, but the drainage that's coming out of the tube now looks a little cloudy.
Yeah.
Mom was concerned it might
like
be an
that
infection,
before.
but the nurse said it wasn't an infection, so she wasn't,
It looked like pus. That's what it looked like.
Right.
It just scared me, but I didn't want to,
Right, and
I don't
again,
know anything about these things.
it does look like, to the untrained eye, it can look like an infection, it can look like pus, and it's normal to be concerned about that, particularly because we talked about, infection is one of the big risks after any kind of surgery. But one of the other things that fluid can be is what we call leakage of lymph fluid. So, do you all know what lymph nodes are in your body?
Yeah, I guess.
You mentioned that you were going to remove some of them that were around the location.
Right, that's right, that's absolutely correct.
Yes.
We did discuss that. Lymph nodes are just little immune organs that drain lymph fluid that circulates through your body, and it helps fight off infection, cancer, other things. And we do remove them in the course of the operation. And in removing them, we have to cut the little lymph ducts that go to the lymph nodes, and usually those are sealed off because the way we cut them, we use a special sealing current, electrical current. But sometimes those little lymph ducts can leak fluid, after the procedure.
Is that exactly what happened? You're saying that happened as a result of the operation?
Yeah, I mean, it happened, the leakage of the lymph is because we removed the lymph nodes. It's not a common complication. It doesn't happen all the time. It's very uncommon, complication, but it can happen.
I don't remember talking about that in the beginning.
You mentioned a lot of possible, complications, but not anything like that.
No, that's absolutely correct. I mean, in some ways it's difficult to mention every single possible complication, particularly if they're uncommon. So I don't always, talk about every single little complication, and I apologize if we didn't cover that one, but normally we just cover the major ones, particularly the life-threatening. It's something we need to fix, obviously, but it's not in any, danger to her overall. It's not going to limit her getting out of the hospital or anything like that.
Well, did something happen during the operation that caused this?
Well, again, it's just in the normal. There wasn't anything, special about the lymph nodes or removal of the lymph nodes. It's just that every so often, some people's ducts are a little bit thicker, or have a little more flow than others, so that the sealing process doesn't always happen perfectly. So it happens. There's nothing technically that went wrong or anything during the procedure. It's just a potential complication that just happened to unfortunately happen. So I'm sorry that it happened to happen to her, but again, I would rather have something like this that we could handle that's not life-threatening than something that that would be more of a danger to her life. Do you guys understand so far sort of what the cause of it is and what's happening with the leakage?